Goiter and nodular thyroid disease. So what's a goiter? Goiter is an enlargement of the thyroid gland, a swelling in the front of the neck which moves on swallowing, and it may occur in both hypothyroidism and hyperthyroidism. And a nodule is a lump or localized growth of cell in the thyroid gland. They can be benign or malignant. Now, what are the complications of the goiter? C, D, E, F, G, H. C for calcification, D for degeneration, and F for fibrosis, G for a growth or a tumor, and H for hemorrhage. So these are the complications of a goiter: calcification, degeneration, fibrosis, growth or a tumor, and hemorrhage. Now, goiter classification on a cause. Three causes: biosynthetic defect, which is more common in the Western world and USA and developed world. Number two, iodine deficiency is the most common cause of goiter worldwide, and it may be due to autoimmunity, antibodies. The biosynthetic defects and the iodine deficiency have common in them that they have decreased thyroxine, increased TSH, and increased radioiodine uptake. So both of them, iodine deficiency goiter and a biosynthetic defect goiter, have increased TSH, increased radioactive iodine uptake, but decreased thyroxine. And in the autoimmune causes, we have TPO antibodies, which are present in the goiters of both Graves' disease, which is hypothyroidism, and Hashimoto's thyroiditis, which is hypothyroidism. TSI antibodies, which stimulate TSH receptor, increasing thyroxine production, and TSI inhibitory immunoglobulins, they attach to the same TSH receptor and they decrease the thyroxine production. Now, goiter classification on cell type. It may be anaplastic cell, which occur in cancer, hyperplastic epithelium that occur in Graves' disease and in iodine deficiency. It may have fibrous tissue that occur in Riddle's thyroiditis, lymphocytic infiltration that occur in Hashimoto's thyroiditis, and a foreign body granuloma occur in De Quervain thyroiditis. So this is the goiter classification on cell type. In the anaplastic type, we have cancer. There are four types of cancer. Papillary thyroid carcinoma, most common, occurs in 80% of cases, and it causes local invasion. Psammoma bodies are characteristic of papillary carcinoma. The second common is the follicular thyroid carcinoma, which occurs in 15% of cases. It causes distant metastasis. The other two types are medullary carcinoma of the thyroid and the anaplastic carcinoma of the thyroid. Then we have the second common cause in the classification is the Graves' disease, which has cell scalping, collapsed folliculi. Because of the excessive activity, the colloid is used, so the follicle gets collapsed, and there is patchy lymphocytic infiltration in the Graves' disease, and the cytoplasm of these cells is pink in color, eosinophilic. Then we have the fibrous tissues, and this is occurring in Riddle's thyroiditis. Then we have Hashimoto's thyroiditis, we have lymphocytic infiltration. So lymphocytic infiltration in both Hashimoto's, but it's patchy in Graves' disease. And then finally we have this foreign body granuloma. Now, goiter classification on the basis of the size and nodules. It may be diffuse or nodular. Both of them, diffuse and nodular, both may be toxic and non-toxic. Nodular may be single nodule or multiple nodular goiter. It may also be toxic and non-toxic.